My name is Dr. Mugisha Kyaruzi. I'm a cardiovascular surgeon specialist working at the university hospital and private institution. So today we're going to talk about the diagnosis and treatment methods of the heart valve diseases. Um, Most of the heart valve diseases are diagnosed by we do very systematic diagnosis of these valve diseases. First of all, we use a very important instrument in our field, which is known as the stethoscope. So, stethoscope during examination, especially physical examination, when you are auscultating the the heart sounds, you might recognize the murmurs of the valves which are not functioning properly. So one of the diagnostic instrument that we use during diagnosis of these heart valve diseases is using the stethoscope during physical examination. And in later times, the gold standard or the commonly used instrument for diagnosing these type of heart valve diseases is the echocardiogram. So when you go to a cardiologist and they do different types of physical examination and recognize that you have murmur in your heart, they then perform the echocardiogram to definitely put out and lay out the type of the valve disease that you have. And also we can use the MRI, magnetic resonance imaging, as one of the tool of diagnosing these valve diseases. But also the CT scans can also be used, especially when patient do have these type of valve diseases whereby you have stenosis and you have a lot of calcium around the valve, which are causing the stenosis. And when these are visualized in the images, they can be referred to cardiologists so that they can definitely perform the echocardiogram, a dynamic picture of the valve, and try to functionally identify whether the valve is leaking or the valve is very stenotic. And we also have the transesophageal echocardiogram, which is which gives a definite results, and it definitely gives out a very good result on what type of a valve disease that you have, whether the valve is leaking and how much is leaking, and how to be intervened and how to be repaired. The most when the patients are diagnosed with the heart valve diseases at early stages, medication is one of a treatment can be used to provide these patients with relief of their symptoms at early stages. But despite of medication which is given at these early stages, and if there is no improvement, we refer these patients to surgery. In most cases, we perform the open heart surgery, whereby we open the chest through either cracking the breastbone or not cracking the breastbone. We either use the endoscope or minimal invasive approaches to reach the heart structure and reach the valve and do different type of procedures, either replacing the valve or repairing the valve. In most cases, the most recommended therapy to these particular patients is the treatment whereby, depending on the stages of what the valve is either leaking or either narrowed. In most cases, when the valve is severely narrowed, we refer these patients to replace the valve. And when it is severely leaking, we either refer them to replace the valve or repair the valve. But when the valve is is mild leaking or to moderate leaking, we mostly follow up the patients with medication. And at the same time, when it is mild stenotic or to moderate stenosis, we do follow up these particular patients. But in some cases whereby we have infection which is sitting on this type of valve, the only solution that we have to this type of infection, which we call the infective endocarditis, we refer these patients for surgery, whereby the infected materials on the valve structures are removed, and if it is possible to repair the valve, we repair it. But if it is not possible to repair the valve, whereby there's a great damage of the valve structures, we remove those damaged structures, and we remove the diseased places, and we replace this type of valve with either metal valve or biological valve or tissue valve, as I've explained before in previous talks. The most approaches that we use in this type of surgeries for either replacing or repairing the valve, in recent years, we use the minimally invasive cardiac surgery, whereby we don't crack the chest bone, we just get through the ribs on the right side, and we reach the heart structures and open heart inside. And after stopping the heart, we open the heart and do replacement or repairing of the valve. But the other type of other techniques of which are right now performed by interventional cardiologists, whereby they use the percutaneous approaches to either, in most cases, they do the replacement of this valve, especially in aortic valve. There is this approach we call TAVI, transcatheter aortic valve implantation, whereby you replace the replace the aortic valve with another valve through the groin. The recovery period of those patients who undergo heart valve surgery, it depends on the type of surgery they have undergone. For those patients who undergo minimal invasive cardiac surgery, they tend to have a very, very quick recovery of almost 5 to 7 days. They get back to their normal daily activities. And those patients who undergo open heart surgery, due to the cracking of the sternum bone, the recovery is a little bit longer. It might be up to 2 months, and this will depend on the physical condition of a particular patient and the healing process of that particular patient. But in most cases, these valve diseases, we prefer using the minimal invasive approaches to replace these type of valves through the right chest with the endoscope or direct vision, or less minimally invasive partial stenotomy, whereby we crack a part of a sternum bone to reach the heart structures and do the surgery of either replacing the heart valve or repairing the valve. So today we have talked about the diagnosis and treatment of these valve diseases, and I hope to see you in the next episode. Thank you.